Today's Safer Sex Sunday is about the who, what, where, when, how, and why of STI testing. Who? Who should be getting tested? Anybody who's sexually active, and that includes oral sex and even some skin-to-skin contact type sex, or genital-to-genital contact type sex. What is an STI? An STI is a sexually transmitted infection. Some people use the language STD, D for disease. The word infection started being used or gained popularity probably in the last 2 decades or so because the word disease has so much stigma, and infection is just a more accurate way to understand the different types of, let's say, conditions that can occur through sexual transmission. What is STI testing? STI testing is the different types of screening that can be done to detect positive STI status. When to get tested is going to be determined by a couple of factors. First factor would be lifestyle and sex lifestyle. So if you're someone in longer term monogamous partnership, you might not get tested as often as someone who is in multiple partnerships or has lots of casual sex, or is someone who's partnered with someone who has multiple partners. Those are all different factors that might inform how often you get tested and what type of testing you do. But another factor is also what we call window periods. How soon can we detect a positive STI or an accurate STI status? Chlamydia and gonorrhea can be tested for within 24 hours of a potential positive contact. The availability of the information based on when an accurate test can happen is also going to inform how frequently you get tested. Where to get tested? Getting tested is something you can do at Family Doctor Walk-in Clinic, CHC. A clinic that specializes in sexual health is always a good option because the practitioners in those clinics are more likely to be better informed of STI trends, and by trends I mean up-to-date information and less stigma. If you do not have regional healthcare, so in Ontario, if you do not have OHIP, you can be tested at a CHC for free, as well as a sexual health clinic most likely, and perhaps even a walk-in depending on how they're funded. I'm speaking very much to Ontario right now, but some of this translates into other provinces and states, I'm sure. How do you get tested? What does testing look like? Beyond showing up to the clinic either by appointment or by drop-in, saying, hey, I would like to be tested for STIs, a lot of times they'll be like, which ones? So the most commonly tested for STIs are the STIs that are most commonly occur, which are chlamydia and gonorrhea. How we test for bacterial STIs, that might be a urine test. Gone are the days that the Q-tip has to go into the dick hole. You can just pee, swab on the genitals or a swab in the throat or the mouth, or also on the anus. And regardless of the genitals you have. Viral STIs are tested through blood. Certain STIs can only be tested through when you're having an outbreak. Things like herpes, things like genital warts, they have to be present in order for a swab to be done or for a visual exam. Parasitic STIs, so crabs, trichomoniasis, as I said, that might be a swab, that might be a visual test as well. Why? Why get tested for STIs? The thing about sexually transmitted infections is that they can be infections that have symptoms, so whether that is discharge or bumps or sores or sore throat or whatever. They can also be things that don't have symptoms. Getting tested allows you to know about your health status, even if you're not having a symptom or nothing feels different about your body. There's so much stigma or negative associations and fears around sexually transmitted infections, but the reality is that infections are part of our day-to-day life. Catching the flu is a very real risk of riding public transit or having a kid who goes to daycare. These are all normalized, and even though people don't want to catch the flu, their value as human beings is not determined by their flu status. A lot of people feel that way about STIs. The more we get tested, the more we have conversations about getting tested, the more normal it seems that we are negotiating different aspects or challenges to our health that occur based on the different types of sex we have, and we're better able to make decisions about the kinds of sex we have with that information. So if I know that I am positive for genital herpes, it might mean that when I'm having an outbreak, the type of sex I'm having during that time does not include barrierless penetrative sex, as an example. Or if I have chlamydia, then I know that I just have to go on an antibiotic, and within 7 days, I can return to exchanging fluids with people if that's what I want to be doing. Getting tested gives us more information to make decisions. It helps to normalize the ways that we take care of our health and how our sexual health is not separate from our overall health. Same way that you would go to the doctor if you had a rash on your arm and get maybe a topical treatment. You do that when you've got a rash on your junk, and then maybe you have to send a text to the people that touched your junk that they might have to do the same test that you just did. We get to stop assigning certain, traits or characteristics of people's value or their worth because of a health status thing. This is really important. I could talk about this forever. This is just supposed to be a quick video, so I won't. But I hope that this who, what, when, where, why, and how, or how and why of STI testing was helpful. You can always find out more information, good information about STIs and testing and ways to prevent transmission of STIs on websites like Planned Parenthood Toronto. Well, it doesn't work like that, ppt.on.ca. But places like that are going to offer you good and up-to-date information about things like STIs. Don't just Google it.